the House Commons staff, Mr. Speaker, for all their efforts, their hard work to allow us to meet today in the way that we are. And before I begin my statement, I'd like also to say that I know the thoughts of the whole House will be with the Honourable Member for Cardiff Central, who is currently in hospital with COVID, and we wish her a full and speedy recovery. Mr. Speaker, with your permission, I'll make a statement about the measures we're taking to defeat this new variant of COVID-19, protecting our NHS whilst it carries out vaccinations that will finally free us from this wretched virus. And, Mr. Speaker, there is a fundamental difference between the regulations before the House today and the position we faced at any previous stage, because we now have the vaccines that are our means of escape. And we will use every available second of the lockdown to place this invisible shield around the elderly and the vulnerable. Already, with Pfizer and Oxford AstraZeneca combined, we have immunised over 1.1 million people in England, over 1.3 million in the UK. Our NHS is following the plan drawn up by the Joint Committee on Vaccination and Immunisation, which is aimed at saving the most lives in the fastest possible time. And given that the average age of COVID fatalities is over 80, it is significant that we've already vaccinated more than 650,000 people in this age group, meaning that within 2 to 3 weeks, almost 1 in 4 of the most vulnerable groups will all have a significant degree of immunity. By February 15th, the NHS is committed to offering a vaccination to everyone in the top 4 priority groups, including older care home residents and staff, everyone over 70, all frontline NHS and care staff, and all those who are clinically extremely vulnerable. And in working towards that target, there are already almost 1,000 vaccination centres across the country, including 595 GP-led sites, with a further 180 opening later this week, and 107 hospital sites with another 100 later this week. Next week, we will also have 7 vaccination centres opening in places such as sports stadia and exhibition centres. Pharmacies are already working with GPs to deliver the vaccine in many areas of the country, and I'm grateful to Brigadier Prosser, who is leading the efforts of our armed forces in supporting this vaccine rollout. We've already vaccinated more people in this country than in the rest of Europe combined, and we will give the House the maximum possible transparency about our acceleration of this effort, publishing daily updates online from Monday, so that jab by jab, honourable members can scrutinise the progress being made every single day. Yet, as we take this giant leap towards finally overcoming the virus and reclaiming our lives, we have to contend with the new variant, which is between 50 and 70% more contagious. The old variant, which the House agreed last month, the tiers that the House agreed last month, was working with the old variant, but alas, this mutation, spreading with frightening ease and speed, in spite of the sterling work of the British public, this mutation has led to more cases than we've seen ever before, numbers that, alas, cannot be explained away by the meteoric rise in testing. When the Office of National Statistics reports that more than 2% of the population is now infected, and when the number of patients in hospitals in England is now 40% higher than the first peak in April, it is inescapable that the facts are changing and we must change our response. And so we have no choice but to return to a national lockdown in England, with similar measures being adopted by the devolved administrations, so we can control this new variant until we can take the most likely victims out of its path with vaccines.